Hi, this is Dr. Rick Townsend, and this is Pastor Keith Carnahan, and we're going to talk about Keith's experience here at the clinic, and I'm going to let him do most of the talking. So, Pastor Carnahan, how is it you happen to be here?
Well, full disclosure, I am your pastor.
That's right.
And we're good friends,
We're
as well.
Yes.
But what a blessing it's been. I came in here after 3 weeks of being in the hospital for a stroke, and I came in a wheelchair.
Yes.
And went from the wheelchair to a walker to a cane, and now I walk without the cane. And so you've done a tremendous amount of good for me and my health, and just got nothing but praise for your work here at the clinic and the blessing it's been to me.
Well, thank you. So let's kind of get into what we did. I mean, when people hear that you're a chiropractor, they kind of have this idea of popping bones and stuff like that. And we haven't done much of that in your case.
Right.
So what are the sort of things we're doing, procedures that we're doing to help you?
Well, when I walked in, I remember telling you that I had a deficit with my shoulder. I wasn't able to shrug my shoulders. And I had been in a rehab hospital for 2 weeks.
And a good one, too.
And a good one,
Yes.
one highly recommended. And but they didn't have a machine like I'm sitting at right here. So I wasn't able to work on my neck except to, in group therapy, try to shrug. I hadn't made much improvement. When I came here and mentioned that to you, you said, well, I have a machine specifically designed to strengthen the neck. And wow, I mean, now I'm about 100% on that particular issue. And so the vibrating machine, they told me that I needed to work on my balance, but they didn't provide a machine that specifically did that.
Yes.
You had that machine, which I think has been a tremendous help. I wanted the facial electrical stimulation because I had a drooping mouth, and I just thought maybe we could rig up a TINS unit. Now, you said, oh no, I have one of those machines.
Got that too.
And so I was just shocked to find out how well prepared you were to deal with my issues. And then I realized that you had much more training in physical therapy than I was aware of. And so that's been a tremendous blessing, but you're very well prepared, not only with knowledge, but also the equipment that you had to offer has been a tremendous blessing. So when I went back for my checkup in Columbia, they were amazed at the progress that I'd made. And also, they mentioned specifically that I didn't have some of the problems that are typical to most stroke victims dealing with muscle issues. And I explained not only did you work with me in therapy, but you are also able to give me a chiropractic adjustment, which helped keep me loose, muscle-wise, and so I haven't had many of the problems that they expected to see.
And I remember that I was kind of like holding my breath. I mean, that was a fine, internationally renowned rehab center that you went to. So I was kind of like holding my breath and see what they thought of your progress, and that was pretty exciting. And we're excited as you continue. But we've done a number of interesting things. We've used microamperage on your face, and we've used a pulse electromagnetic frequency literally on your brain. We put a electromagnetic impulse that goes directly through his brain, where the stroke site is at, and we've used a vibrating platform that he talks about, and detoxification, and we brought all of these tools together, plus my 30 years of experience, and I'm not trying to brag, but this is where I've dedicated my life. This is what I've wanted to do with my life, and I've put in the time and got the degrees and did the work. And here's where it shows off, right here with someone like Pastor Carnahan, because this is where the rubber meets the road when you start seeing patients get well. And I thank God that he has given me these skills and this equipment, and we give him full credit, our God, for being the great physician.
Amen.
So anything you want to add to that, Pastor
Well,
Keith?
I was also going to say I've been really thankful for your work with my emotions. Stroke victims have, a problem containing their emotions many times. When I came to you, I was very concerned about that because being a public speaker, Anything that moved me emotionally would trigger an emotional outburst.
Yes.
And they had me on a mood-altering drug when I came here, and we were able to eliminate that gradually, and I've made great progress in that area as well. And again, it's because of your expertise, the things you knew that would be helpful to me, and I certainly want to thank you for that as well.
You're welcome. Well, that's an interesting area. We had to get out of the box to address the emotional issues.
Right.
And so we've actually used colored glasses and tuning forks and frequencies, things that most people never even heard of. But we did a good job there, didn't we?
Well, in the brain tap, as I sat there this morning, I just thought how relaxed I felt, how positive I felt after going through that treatment. And it's just a tremendous blessing. I, of course, don't understand perhaps which of the procedures has helped me the most, but certainly combined, I've made tremendous improvement. And I have other friends who've had strokes who haven't been able to avail themselves of your help, and they've suffered with that emotional issue much longer than I did.
That's very
So it's quite a difference in my experience.
Well, it's been my pleasure. We thank God for the direction, and we're sure happy, Pastor Keith, with your great progress.
Well, we appreciate what you've done for us.
Yeah, thank you.